How to safely expose kids to dirt and germs. Sometimes it seems that modern society is terrified of dirt and germs, even though it is clearly impossible to avoid them. We boil, sterilize, and use various chemicals to clean and spray everywhere. We overuse antibiotics, covering every cut and scrape with antibiotic ointment and using oral antibiotics even when there is little reason to. There is growing evidence that not only is it impossible to avoid dirt and germs, but avoiding dirt and germs actually can harm our kids and ourselves. Learn how to safely expose your kids to dirt and germs so you can keep them healthy. Method 1: Exposing your children to dirt and germs. 1. Allow your children to play in the dirt. It is okay to let your kids literally play in the dirt. Playing in the dirt will expose your kids to important groups of microorganisms found in the air, dirt, and water. However, your kids should still be cleaned up afterwards. Let your kids enjoy making mud pies. However, you should refrain from letting them eat mud pies. 2. Let your child play with your pet. If you have a dog or cat, you shouldn't restrict your child from playing with them. As long as your pet is reliably good-natured, let your children play on the floor or out in the yard with them, but make sure you supervise young children with pets at all times. Studies have indicated that the exposure to pet dander can decrease the risk of asthma and allergies. 3. Don't panic if your kids share food items and utensils. While it's best to avoid the sharing of straws, sippy cups, forks, spoons, glasses, and food, there's no need to freak out if your children share. There is so much contact amongst siblings that there is little point in trying to prevent it. Among your kids' playgroup friends, you should try to prevent kids from sharing slobbered on items, but it's not a huge deal if some sharing happens before you can intervene. Absolutely limit the sharing of food items if the other children are clearly sick or if your child has food allergies. 4. Refrain from overwashing. You don't need to wash your child or clothes every day. Your child will be okay going a day or two without a bath. This helps expose your child to both good bacteria they may need or other germs that can help boost the immune system. However, if your child is obviously in need of a bath due to being dirty or smelly, then have him take a bath. You also don't need to wash your child's clothes every time he wears them. You can let your child wear it 2 or 3 times before washing it. Method 2: Reducing your child's contact with infectious germs. 1. Teach children how to wash their hands. Kids and adults of all ages are constantly putting their fingers and hands into their mouths, noses, and eyes. This spreads germs of all kinds, both good and bad. Teach your children the proper way to wash their hands. They should wash them for at least 20 seconds. Have your child sing the happy birthday song twice to teach the proper length of time, while scrubbing under their nails and using lots of sudsy soap. Children should wash their hands before eating. Often when she or anyone she is in contact with is sick. After using the toilet. In crowded places like stores, malls, theaters, and parks. If they are clearly dirty. 2. Use antibacterial products sparingly or not at all. Antibacterial products are not a necessary product if you have a child, though many people use them all the time. Antibacterial soaps are not needed, nor are they very effective. They can also expose your kids to unnecessary chemicals. If you use them, don't use them all the time. Antibacterial soaps and hand sanitizers may inhibit the development of your child's immune system. Alcohol-based portable sanitizers can be very useful, but the alcohol can be very drying. Use these products sparingly. The best hand wash is still soap and water. 3. Limit the use of antibiotics. Antibiotics only work on bacterial infections, though many times people take prescribed antibiotics for viral infections. Talk to your doctor to see if an antibiotic is really needed, or if the infection may be viral or can be fought off without antibiotics. Use antibiotics only when there is a bacterial infection. You can also give your child's immune system a chance to exercise and practice. If your child gets a cut or scrape, keep it clean and covered. However, you don't have to use antibiotic cream for minor cuts. Overuse of antibiotics can lead to development of resistant bacteria, which can be tough to treat. Instead of using antibiotics, you can use natural sources of antibacterial, antiseptic, antifungal, and antiviral remedies if an infection is minor or your doctor says it's okay. These include things like oregano, echinacea, garlic, and honey. Make sure to follow the directions for antibiotic use exactly. Part of the reason that antibiotic-resistant bacteria are an increasing problem is that the full dose of antibiotics was not given, leaving the small number of antibiotic-resistant bacteria room to grow. 4. Limit the use of cleaning rags or sponges. Sponges and dish rags can be sources for bacteria. To help reduce the amount of bacteria you and your children are exposed to, you should change or wash your dish rags and sponges often. When you use dish rags over and over again, you are actually spreading the bacteria around more. 5. Refrain from letting your kids eat food from the floor. Ignore the 5-second rule for food that falls on the floor. 5 seconds is plenty of time for food to pick up loads of germs, along with whatever else on the floor. If food falls onto the floor, throw it away. While we want to expose kids to dirt and germs, that is not the same as wanting to feed our kids dirt and germs. Method 3. Understanding the hygiene hypothesis. 1. Learn what the hygiene hypothesis is. The hygiene hypothesis states that exposure to germs of all kinds actually teaches the immune system to respond to infectious organisms with a balanced and effective response. The thought is that by cleaning and sterilizing our environment, we are actually inhibiting an appropriate immune response and changing the gut microbiome, which is essential for teaching the immune system and maintaining health. We also are increasing the risk of disorders such as asthma, eczema, allergies, autoimmune disorders, and chronic inflammatory disorders. Many diseases that are reaching epidemic proportions are chronic inflammatory disorders. These include diabetes, obesity, heart disease, arthritis, digestive disorders such as inflammatory bowel disease, neurological disorders, lung diseases, cancer, and others. 2. Recognize the evidence that supports the hygiene hypothesis. One of the earliest studies providing support for the hygiene hypothesis followed over 17,000 children born in 1958. The study found that the more older siblings a child had, the less the chance was that they would have hay fever. Other studies found that children in rural areas, exposed to dirt, germs, farm animals, manure, and an overall more natural environment were less likely to develop asthma, eczema, and allergic disorders. A recent study showed that newborns that are exposed to dirt and germs have a lower risk of allergy and asthma. 3. Know the other risk factors that might influence the hygiene hypothesis. The question of whether dirt and germs lower risk of diseases is actually a very, very complicated question. A number of factors could be playing into the association between exposure to dirt and germs and the decrease in the risk for a number of different diseases. Some of these factors are changes in diet, environmental pollution, and breastfeeding practices. Another factor may be the rise in the use of antibiotics, especially in childhood and for virally caused diseases. What does appear to be true is that the more people have become concerned with clean surfaces and sterilizing their lives, the more the population as a whole, particularly children, have been experiencing allergies, asthma, and eczema in their youth and a variety of chronic inflammatory disease in both youth and adults. 4. Know that some germs are good. Some germs are good and essential for living. One example is the populations of bacteria living in our guts. The gut microbiome is vital for overall health and not only help educate the immune system, but provide us with vitamins and other nutrients, help support digestion, and help bowel regularity. You also have good bacteria in your nose, which helps fight other infectious bacteria. These are considered good bacteria. Other germs are obviously not good. They cause various diseases and infections.